I'm Professor of Digital Health and Chair in Translational Cancer Genomics in Queen's University, Belfast. I'm really excited about this All-Ireland Cancer Research Initiative. We have a huge opportunity here if we work together. Cancer knows no borders, so neither should we. I feel that working together, bringing together the best minds on the island of Ireland to address one of human health's greatest challenges is the way to go. And in order to do that, we need to really recognise that we all have different skill sets, but complementing them together makes us bigger than the sum of our parts. The other thing that's really important is we have to focus on the patient. So our mantra in relation to with the patient, for the patient, and around the patient. The other thing is we have a lot of bright young people, be it in digital health, be it in molecular biology, genomics. So bringing all that together into that milieu really is going to make it an exciting time, and we can really deliver for our patients on the island of Ireland.
I'm Debbie Keatley. I'm a member of Northern Ireland Cancer Research Consumer Forum, and I'm a patient. I'm a breast cancer patient. I'm a patient advocate now. I think really for people on this island, it's important to remember that cancer doesn't care about a border. There's so much that we can do together, better, quicker, and it's really important that when you get a diagnosis, wherever you are in Ireland, that you have access to better treatments, all the treatments that are available, and we need to accelerate getting treatments into clinic for patients here.
My name is Lorraine. I'm Professor of Pharmacology and Biomedicine at the School of Pharmacy and Pharmaceutical Sciences, and I'm the research lead of Trinity St James's Cancer Institute. I think the main value is bringing researchers together, scientific researchers, clinical researchers, but also patient advocates and industry to work together for the common good of cancer patients across our island.
I'm Chris Scott from Queen's University of Belfast, and I'm Director of the Patrick G. Johnson Centre for Cancer Research. For me, it's really the sharing of expertise, and across the island of Ireland we have got fantastic experts at both discovery research, translational research and clinical research. But across the island, we've got different specialities in different regions, and what this initiative and this institute will allow us to do is to bring all that together. So ultimately we're improving the skills across the island, which will have impact on patients' lives.
My name's Eibhlín Mulroe, and I'm the CEO of Cancer Trials Ireland. I think the value of an All-Ireland Cancer Research Institute is that, number one, we can work together in a collaborative way on the island to deliver more trials for Irish patients. So that's the perspective I'm coming from. More treatment options for Irish patients, and you can't really do that in isolation in one hospital or in one research institution. You get a better bang for your buck in trials and in cancer trials if we all work together, not just on the island, but in Europe and also with the US. And that's why our collaboration with the National Cancer Institute and with European collaborative and academic groups are really important. The second thing, and the second piece that I'm really passionate about, is that patients on this island have equity of access to trials. And that comes through access, if you're a patient living in Donegal, that you could potentially go to Derry to access a clinical trial and vice versa. And the patients are really involved in the decisions we're making in the Cancer Research Institute, and that's what I love about it, is that they're part of it, they're part of the steering group, and they're part of our strategy and where we're going.
My name's Louise Mullen, and I'm delighted to be here. I work for the National Cancer Control Programme, and I lead on the area of cancer survivorship there. It's great to be here and to feel the sort of energy in the room around AICRI today, and I think the benefit is really in leadership and driving forward, particularly around collaboration. It gives us a chance to come together and to talk about our different areas and our different focuses around cancer research, and to really make progress together with other people who have similar and different interests.
My name is McKeon. I'm a patient advocate, and I had breast cancer. I was diagnosed in 2017. The biggest reason I came here today and why I'm interested in the Institute is because of the fact that it's about connecting the dots. And as a patient, for me, that was the biggest concern. There didn't seem to be a lot of joined up thinking. So it's really inspiring to see that all of these really clever people are getting together to coordinate and collaborate and help each other in their research.
My name is Aedin Culhane. I'm Professor of Cancer Genomics at the University of Limerick and Director of the Limerick Digital Cancer Research Centre. I think it's critical that we join up cancer research on the island of Ireland. Ireland is a small country and we need to collectively work with Europe, with America internationally, and we also need to leverage what they have. And when we work together, that we will be able to do that better.